Welcome back to Today's Health. Today we're talking about recommendations for a healthy pregnancy with OB-GYN Dr. Stacey Tremp. Dr. Tremp, now as you get closer to the end of your pregnancy, after 36 weeks, how often do you have to see your doctor?
Usually we see you every week until you have the baby. At 36 weeks, we'll do a swab called a group beta strep swab. That tests for that bacteria itself, group beta strep. We know that if you're positive for GBS, that you can have a baby that is sick if it's born vaginally. So we test for that. If you're positive, we give you antibiotics in labor, thus treating the baby itself. And we're going to check your cervix. We're going to talk about labor precautions and all of those things during those visits.
So there's a lot more going on those last few visits.
There's lots of questions usually during those last few visits about when to go to the hospital, how do I know if I'm in labor? So there's lots of things that usually get brought up during those weekly visits until she has that baby.
So how do you know if you're in labor? A lot of women have contractions and...
They do, and some people are chronic contractors where they'll contract throughout the pregnancy and they're pretty stable. But true labor contractions are regular, painful contractions, usually 5 minutes or less apart, where they're getting stronger in nature, lasting about an hour itself. That's associated with cervical change. Cervical change sometimes can cause some vaginal bleeding. All of these things are signs that you could be in labor. If you see any of those signs or you're feeling any of those signs, it's important that you head to the hospital, go to OB triage, and you're seen and evaluated.
Now this might sound like a simple question that we should all know the answer to, but how do you know if your water breaks?
That's a common question actually, and a lot of people either have had children and never had their water break, or they're concerned that their water is going to break at home. So the things that I had 3 children and none of my water did not break with any of them. So my patients tell me that they typically will hear a pop and a gush of fluid that runs down their leg. Continuous gushing fluid would be a sign of rupture of membranes or your water breaking, and it's important that you're seen at the hospital and OB triage.
Doctor, this has been great information today. Do you have any closing comments for our viewers?
I wish them well and, good luck.
Thank you for joining us today.
Thank you so much.
And thank you for watching. If you have questions, need a physician referral, or have suggestions for topics you'd like to hear more about, you can contact us by calling Health Access at 1-800-228-1484. You can also watch Today's Health, request a copy of our program, and access other reliable healthcare information by visiting our website. As always, tune in next time to Today's Health. Today's Health is brought to you by McLaren Port Huron.